As temperatures break all records, hospitals in the National Capital Region are witnessing a significant surge in outpatient and emergency cases related to heat-induced illnesses. On Wednesday, the weather station in Delhi's Mungeshpur reportedly registered India's hottest day ever at 52.3 degrees Celsius. Most patients visiting the emergency department are elderly or have a medical history. Experts told News18 that seniors and children are at greater risk as well as individuals with chronic conditions like diabetes, hypertension, cardiovascular diseases or those on specific medications. The most common ailment due to high temperature is dehydration, which can be identified by dry mouth, fatigue and low urine output. Additionally, people are fainting due to low blood pressure. Such heat-related complaints have increased noticeably at hospital OPDs and emergency departments across Delhi-NCR. The majority of patients coming to hospitals are elderly with chronic conditions such as respiratory, heart and kidney diseases and diabetes. Doctors say that many patients arrive in a state of shock and about 5% need hospitalization. Doctors are also witnessing viral gastroenteritis combined with heat-induced dehydration, which is causing severe illness. Heat illness contains a spectrum of disorders that arise from the body's inability to cool down effectively, ranging from mild heat cramps to severe, life-threatening heat stroke. Common heat illnesses include heat cramps, characterized by muscle pains or spasms, often in legs or abdomen, and heat exhaustion marked by heavy sweating, weakness, dizziness, nausea, headache, and muscle cramps. The most severe is heat stroke, which presents with a high body temperature of above 104 degrees Fahrenheit. In this condition, patients go into confusion mode with rapid pulse and may pass into unconsciousness and hence require immediate clinical intervention to avoid life-threatening condition, as there are chances of witnessing a stroke or multi-organ failure. Hospitals generally stabilize patient conditions, often with intravenous fluids for rehydration, and closely monitor vital signs. While severe heat illness can cause long-term damage to vital organs, experts insist that prompt treatment can often prevent stroke. How to stay cool? Factors like poor hydration and strenuous physical activity further increase the risk of heat stroke and heat illnesses. To prevent heat illnesses, individuals should stay hydrated, avoid excessive outdoor activities during peak heat time starting from 12 noon to 4 p.m., wear light clothing and use fans or air conditioning. Doctors advise minimizing sun exposure, staying indoors as much as possible, and ensuring adequate fluid intake in form of water, coconut water, lemon water and buttermilk. To understand it even better, let's hear this out from experts.
As you know, a heat wave has swept across northern India and the temperatures have exceeded in many places 45 to 48 degrees Celsius, and because of that a lot of heat related diseases are coming to our OPD. Around 2 to 3 patients per day are coming to the OPD. So basically the symptoms of these diseases are that the patient has exercised in hot outdoor weather or maybe in an indoor situation where there is no cooling. So the patient has excessive sweating and becomes dehydrated, and because of that the symptoms may be that there is nausea, vomiting, dizziness, extreme weakness, the patient has cramps all over the body, feels very thirsty. Sometimes when these symptoms increase, then it may lead to heat exhaustion, where the patient also has extreme weakness along with low pulse, and he may have drowsiness and fainting, and he feels so weak that he has to have IV drip and has to have cooling measures administered in the hospital. And if it even becomes more severe, then it is called heat stroke. So heat stroke is an emergency condition where the body's temperature exceeds 40 degrees Celsius and the body's temperature control mechanism is completely lost. So The patient has extreme exhaustion, which may even lead to loss of consciousness and coma, and the patient may even have seizures. His pulse is low, he can go into shock, and the patient needs emergency hospitalization. Meanwhile, while awaiting the ambulance, the patient should be kept in a cool area, and the patient should be sprayed with any water, cool water, and his clothes should be loosened, and if possible then ice pack should be kept in the armpits, the groin area, and also in the back of the neck, and fan or AC or cooler, anything should be started, and if possible the patient should be given some fluids. Now, it is most important to prevent these conditions so that such emergencies do not happen. So basically, first of all, you should avoid exercising in outdoor conditions or in indoor conditions where there are no ACs or fans, especially for the elderly and young children. And even if you have to exercise, then you should keep on taking any amount of water, electrolytes like ORS or energy drinks, so that have to be repeatedly sipped, so that all the sweat that goes away, that is replaced by those fluids. Secondly, one should always exercise in a situation where there is some kind of cooling or in a shade. So if you avoid these situations, if you keep yourself hydrated, so you may avoid these conditions in this extreme weather. So always keep hydrated. That's the message. Thank you.